Assalamu alaikum wa rahmatullahi wa barakatuh. Bismillahir Rahmanir Rahim. The aim of a fourth lecture of acute inflammation is to visualize the 8 morphological patterns of acute inflammation and what are you seeing by gross naked eye inspection or gross examination of tissue in acute inflammation. There are 8 morphologic patterns of acute inflammation. On light microscopic examination, all acute inflammations are characterized by vascular changes and neutrophil infiltration, which are the microscopic features of acute inflammation. The morphologic patterns depend on the severity of inflammation, its specific cause, and the particular tissue involved. All can modify the basic morphology of acute inflammation, and the importance of recognizing these morphologic patterns is to suggest a specific underlying cause. So there are: first, Catarrhal inflammation; second, serous inflammation; third, Fibrinous inflammation; fourth, Suppurative or Purulent inflammation with abscess formation; fifth, Hemorrhagic inflammation; sixth, Pseudomembraneous inflammation; seventh, Gangrenous inflammation; and eighth, Ulceration. So, the morphologic or pathologic features of any disease include the gross or macroscopic features by naked eye examination and microscopic or histologic features by light microscopic examination. We start with first Catarrhal inflammation. Catarrhal inflammation is a mild acute inflammation of the mucous membrane, in which there is excessive mucus fluid secretion and little necrosis of the tissue. Example, as in the common cold or coryza, in which there is nasal obstruction due to the congestion of the nasal mucosa. Catarrhal inflammation is the commonest type of acute inflammation. This is a catarrhal inflammation of the pharynx, in which there is redness, swelling, and congestion with engorgement of blood vessels of the pharyngeal mucosa, but there is no necrosis of the mucosa. So, catarrhal inflammation is a mild acute inflammation of the mucous membrane. Second, serous inflammation. Serous inflammation is an acute inflammation of serous membrane, so it is called serous inflammation. It is characterized by formation and accumulation of clear watery fluid in the serous cavity, such as pleural, peritoneal, pericardial, and synovial cavities, which are called effusions. So, effusion is defined as accumulation of fluid in the serous cavity, and ascites is defined as accumulation of fluid in the peritoneal cavity. So, in the serous inflammation, the inflammatory exudate is serous exudate, which is watery fluid. Other examples of accumulation of serous fluid are skin blisters resulting from burns or viral infection. This is a burn blister in the skin resulting from the accumulation of serous fluid within the epidermis of the skin, and it is an example of serous inflammation. Third, fibrinous inflammation. It is a severe inflammation of serous membrane with excessive deposition of fibrin in the serous cavity which is fibrinous exudates. The fluid is removed from the fibrinous exudate by lymphatic vessels, and the fibrin remains on the surface of the serous membrane. So, both visceral and parietal layers of serous membrane are stuck by fibrin meshwork, and when separated from each other, giving bread and butter appearance, which is resembling the spread of butter on the surface of the bread, as in the fibrinous pericarditis. The fibrin may be degraded by fibrinolysis and removed by macrophages with clearance of cellular debris, resulting in resolution, which means return to the normal tissue structure. But large amount of fibrin cannot be completely removed and is replaced by the ingrowth of blood vessels and fibroblasts, and will be converted to the fibrous scar by process of organization, leading to the fibrous adhesion of pleura or pericardium and causing interference with lung or heart function. So, organization is defined as replacement or converting of fibrinous exudate into the fibrous scar by ingrowth of blood vessels and fibroblasts. This is picture of fibrinous pericarditis. There is excessive deposition of fibrin on the pericardium, giving bread and butter appearance of fibrinous inflammation. This is picture of the heart, shows the fibrous adhesion of pericardium when it is separated from the heart. This fibrous adhesion resulting from the organization of fibrinous exudate that interferes or restricts the myocardial function. This is the microscopic cytologic feature of fibrinous exudate, containing large amounts of fibrin as a pink fibrin meshwork and scant or few number of inflammatory cells. For suppurative or purulent inflammation and abscess formation, it is characterized by the collection of large amounts of purulent exudate or pus, and it is caused by biogenic bacteria, which are called pus-forming bacteria. Bio means pus, genic means forming, such as Staph aureus and Streptococcus pyogenes. Examples of suppurative inflammation are boil or furuncle, which is abscess of the hair follicles, and empyema is a collection of pus in the body cavity, such as pleural or peritoneal cavity, or a hollow organ, such as empyema of gallbladder. What is the pus? Pus is a thick, creamy, viscous, yellowish or greenish fluid, and the pus consists of dead and dying neutrophils, fluid or exudate, bacteria, and necrotic tissue or cellular debris. So, the pus is a purulent inflammatory exudate rich in the neutrophils and cellular debris. This is microscopic cytologic features of pus, in which there are numerous dead and dying neutrophils in the center of the field, which have 3-lobed nuclei, and few scattered macrophages have single, round or oval nucleus with abundant pinkish cytoplasm containing phagocytized cellular debris. Abscess is defined as a localized collection of pus, has a central cavity of liquefactive necrosis, and is surrounded by a layer of inflamed granulation tissue, which is called biogenic membrane, consisting of proliferating fibroblasts and congested blood vessels. The outcomes of abscess are either burst by itself, or surgical drainage, or healing by fibrosis and scarring, which is the usual outcome of the abscess. This is a perinephric abscess, occurs as a complication of acute suppurative bacterial infection with inflammation of the kidney called acute pyelonephritis, with spread of infection from the kidney to the perinephric fatty tissue or adipose tissue, causing perinephric abscess, which appears as a localized collection of greenish pus material in the perinephric fatty tissue. There is a suppurative or purulent inflammation with abscess formation within the hair follicles, which is called boil or furuncle. There are collections of pus within the hair follicles, appear as yellowish greenish collections. This is abscess formation with a pocket of pus in the posterior aspect of the axilla. There is a pouring of pus from the opening of the axillary abscess. This is suppurative or purulent inflammation of the lung with abscess formation, which is suppurative bronchitis. Multiple bacterial abscesses within the bronchi and bronchioles as a complication of bronchopneumonia with suppurative bronchitis appear as whitish yellowish collections of pus within the bronchi and bronchioles, as indicated by the arrows. This is microscopic histologic features of a previous slide of suppurative bronchitis, in which the bronchial lumen is filled by pus material with abscess formation. So, abscess is a localized collection of pus, has a central cavity, contains neutrophils and cellular debris, and is surrounded by a layer of granulation tissue, which is called biogenic membrane, of congested blood vessels and fibroblast proliferation, which is indicated the attempt to healing and repair. Fifth, hemorrhagic inflammation. This patient has generalized multiple hemorrhagic patches and hemorrhagic rash in the skin of the face, chest, abdomen, and extremities due to the vasculitis, which is acute inflammation of the cutaneous capillaries. 6. Pseudomembranous inflammation. It is a very severe ulcerative inflammation of the mucous membrane with extensive necrosis of the surface epithelium or mucosa, and there is a formation of pseudomembrane, which is whitish dirty membrane consisting of exudate, fibrin, neutrophils, RBC, bacteria, and tissue debris. Examples of pseudomembranous inflammation are diphtheria, which is acute bacterial infection of the larynx by Corynebacterium diphtheriae, and pseudomembranous colitis, Pseudomembranous colitis is a opportunistic infection caused by Clostridium difficile and related to the antibiotics therapy such as lincomycin and clindamycin. These antibiotics alter the normal bacterial flora in the bowel, such as Clostridium difficile, and cause overgrowth of Clostridium difficile, and this resulting in pseudomembranous colitis as a side effect of these antibiotics. So, the patient presents with fever, abdominal pain, and watery diarrhea. This is the gross or macroscopic feature of pseudomembranous inflammation of the larynx, with the formation of whitish, dirty pseudomembrane covering the surface epithelium or the mucosa of the larynx, as in case of diphtheria. And this is the gross or macroscopic feature of pseudomembranous colitis, with the formation of pseudomembrane covering the mucosa of the colon. 7. Gangrenous inflammation, which is a more serious and fatal type of acute inflammation. Gangrene is defined as tissue necrosis with putrefaction due to the invasion with digestion of tissue by saprophytic bacteria, like putrefaction of meat in hot weather. Gangrene is characterized by black discoloration of tissue with bad odor or foul smell. Example of gangrenous inflammation is diabetic foot with gangrene. Diabetic patient usually develops atherosclerosis of blood vessels of lower extremities, leading to the ischemia of lower extremities or leg, in addition to the peripheral neuropathy with loss of sensation in the foot and toes of the diabetic patient. So, any trauma or injury to the foot or toes with infections may cause diabetic foot with gangrene, as in the neglected cases or neglected patient. Other example of gangrenous inflammation is gangrenous bowel, the volvulus. This picture shows gangrenous finger with a black discoloration at the tip of the finger and redness of the skin. And there is a progressive spread of gangrene more proximal in the tissue. This is diabetic gangrenous foot. There is gangrene of the toes with black discoloration and redness of the skin and subcutaneous tissue. This is also diabetic gangrenous foot with black discoloration of the gangrenous toes involving the skin and subcutaneous tissue with foul-smelling discharge. Also, there is a progressive spread or a propagation of gangrene more proximal in the tissue. So, the ordinary or usual treatment of gangrene is amputation of the gangrenous part at the level of the healthy tissue to prevent the propagation of gangrene with good antibiotic cover. This picture of gangrenous small intestine due to the volvulus, and there is a black discoloration with the distension of small intestine. Volvulus is a twisting or torsion of the bowel, causing ligation of blood vessels at the root of the mesentery and cut off blood supply, leading to the ischemic necrosis of the bowel, with the infection and digestion by normal bacterial flora in the bowel, causing gangrenous bowel or gangrenous intestine. 8. Ulceration or ulcerative inflammation. Ulcer is defined as a loss of continuity or local defect of surface epithelium, such as skin or any mucosa in the body, as gastrointestinal tract mucosa or genitourinary tract mucosa. Ulcer is associated with acute and chronic inflammations, which induce necrosis of cells with sloughing or shedding of inflamed necrotic tissue of surface epithelium or mucosa of involved organ. So, ulcer is regarded as a morphology of acute inflammation and chronic inflammation. There is acute ulcer and chronic ulcer, depending on the causative age of the ulcer and the duration of the ulcer. Example of ulceration or ulcerative inflammation is gastric or peptic ulcer and ulcerative colitis. This is the morphology of duodenal ulcer. Shows both gross or macroscopic features and microscopic features of duodenal ulcer. Grossly, there is a prominent local defect in the mucosa or in the wall of the duodenum. On microscopic examination, there is duodenal ulcer crater with the loss of continuity of duodenal mucosa by a local defect, and the base of ulcer is covered by inflammatory exudate. On both sides of the ulcer, there is normal intact duodenal mucosa. This is a gross feature of a prominent gastric ulcer in the mucosa or in the wall of the stomach. This is ulcer in the skin, and the base of ulcer is covered by acute inflammatory exudate. This patient has a large gluteal abscess with sloughing or shedding of inflamed necrotic skin and subcutaneous tissue, leaving a large gluteal ulcer with an acute inflammatory exudate in the base. Thank you for your listening.